Good morning. I'm going to talk about the anatomy of the conjunctiva in this presentation. And in this presentation, I will take you through embryology, gross anatomy, histology, vascular supply, nerve supply, and the lymphatic drainage. Embryology, the conjunctiva develops from the ectoderm lining of the lid and covering of the globe. So it is essentially ectodermal in origin. The conjunctival glands, they develop as a growth of the basal cells of the upper conjunctival fornix. There are fewer glands that develop from the lower fornix also. Conjunctiva is the term which is derived from the word conjoin. That means to join. It is a mucous membrane that joins the eyeball to the lids. It is a translucent mucous membrane which lines the posterior surface of the eyelids and anterior aspect of the eyeball. The conjunctiva stretches from the lid margin to the limbus with conjunctival sac in between. So if you look at the parts of the conjunctiva, it is divided into three parts for the sake of the description: palpebral, bulbar, and the fornix. These are the three parts. The palpebral is subdivided into marginal, tarsal, and the orbital parts. I'll take you through that one by one. The conjunctiva, the bulbar conjunctiva is divided to scleral and the limbal part, and the fornix is divided into superior, inferior, lateral, and the medial parts. So let's go one by one. This is a picture which shows what I mean. And when I say marginal, it is from the opening here up to this area. This is the marginal conjunctiva. Then comes the tarsal conjunctiva. Then comes the orbital part, fornix, and so on. So the palpebral part, as I said, is divided into three: marginal, tarsal, and the orbital parts. The marginal conjunctiva, it extends from the lid margin. There is the opening of the tarsal plate, as I have shown in the picture, to the sulcus subtarsalis, right? So the sulcus subtarsalis, actually, it marks the inferior edge of the tarsal plate. So we can say that the sulcus subtarsalis is actually a shallow groove that is situated 2 millimeters from the lid margin, right? The lacrimal punctum opens into the marginal zone. So this sulcus subtarsalis and the marginal conjunctiva has got an importance. Then comes the tarsal conjunctiva. So it is that part of the conjunctiva that is firmly adhered to the tarsal plate. It is thin, transparent, and highly vascular structure. The meibomian glands appear as yellow streaks through the tarsal conjunctiva. If you look at carefully, you can visualize that these are the meibomian glands, or the ducts of the meibomian glands, as the yellow streaks. The orbital part of the conjunctiva, it extends from the upper border of the tarsal plate to the fornix. It is loosely attached to the superior tarsal muscle, that is the Mueller's muscle, and so it folds readily. It's a shallow grooves and elevations are present in this, and they are called stida, platoids, and the grooves. So these are the three parts of the palpebral conjunctiva. If you look at the applied aspects of the palpebral conjunctiva, we know that this is site for the papillae and the follicles that are seen in the palpebral part. These papillae and the follicle formation is actually a reactive pathology. Let's see how they differentiate from each other. Papillae it's composed of the chronic inflammatory cells, the lymphocytes and the plasma cells, and they have a blood vessel in the center. I'll show you the picture also. Whereas the follicles are composed of the lymphoid aggregates. The papillae, The giant papillae are present in a situation such as allergic diseases or vernal catarrh, for example. And the long-term use of the contact lens, ocular post-enucleation process. It is basically a toxic or an allergic response of the conjunctiva that is seen in the form of the papillae. Whereas the follicles is seen characteristically in the viral chlamydial infection and the toxic type of the conjunctivitis. This is what I mean. When I say papillae, you can see that it appears like this. And if you look at the histology, this is the papillae, and there is a central vessel, as I have shown in this picture, the fibrovascular core, right? Whereas the follicle, it is an aggregate of the lymphocytes, a lymphoid aggregation. That's all. All right. Coming to the bulbar part of the conjunctiva, it is divided into scleral and the limbal parts. It is this part of the conjunctiva that covers the globe. This white area actually is the sclera, and a transparent membrane covering the sclera is the bulbar conjunctiva, right? The applied aspect of the bulbar conjunctiva actually they loosely adhered. It used to be very around in the glaucoma surgery. When you do a conjunctival dissection, you can very freely perform the conjunctival dissection in surgeries such as glaucoma surgery. Because of its healing property, the conjunctival flake plays on the non-healing ulcer, for example, in the conjunctival hooding. So if you just cover the defect with the conjunctival flake, it can easily adhere and may provide nutrition to a non-healing ulcer. They also use the conjunctival transplantation in the leaking filtering blade and chemical burns of the cornea. For the same reason as I mentioned, and conjunctival biopsy material can be obtained with little discomfort because it is very loosely attached and there is a lot of redundant conjunctiva. Scleral conjunctiva is actually a thin, transparent, loosely attached to the underlying sclera. It permits visualization of the conjunctival and the episcleral vessels, as I have shown in that picture. It is separated from sclera by the episcleral vessels and the Peyer's capsule. The applied importance of this part of the conjunctiva, the scleral conjunctiva, is seen in icterus. The scleral icterus is seen in the jaundice. Pigmented changes are seen in ochronosis. Whited spots or bidot spots are seen in the vitamin A deficiency. Keratinization seen in the Stevens-Johnson syndrome, vitamin A deficiency, and facial thyroid. See, the point is that it is this part, the scleral part of the conjunctiva, that is very useful, and it provides certain diagnostic features of several diseases. So, we look for pallor, icterus, and pigmentation essentially. The limbal conjunctiva is a 3 mm ridge around the cornea. This conjunctiva, Peyer's capsule, and the episcleral tissue, they are fused together here. So, you may not be able to dissect pure conjunctiva, but you will dissect the Peyer's capsule along with this. It is strongly adhered to the sclerocorneal junction. So, we understand that there is a palpebral part, there is a bulbar part. The bulbar part consists of scleral part and the limbal part. And thereafter, we now move on to the fornical conjunctiva. The fornix or the fornical conjunctiva, it joins the bulbar and the palpebral conjunctiva. The ducts of the lacrimal gland open into the lateral part of the superior fornix. So, this has got some importance. The superior fornix is 8 to 10 millimeters from the limbus, inferior 8 to 9, lateral 14 millimeters from the limbus. However, the medial fornix is absent. There is no medial fornix. Now, if you look at the histology of the conjunctiva, it is divided into 3 parts: epithelium, adenoid layer, and the fibrous layer. The adenoid layer and the fibrous layer together are sometimes termed as substantia propria. So these are the 3 main layers of the histological layers of the conjunctiva. If you look at the characteristics of these layers, especially the epithelium, in the different parts of the conjunctiva, it is something like this. The marginal conjunctiva is a 5-layered, non-keratinized, stratified squamous epithelium, whereas the tarsal and the orbital part of the conjunctiva is a 2-layered, stratified cuboidal epithelium. The fornix and the scleral part is a 3-layer stratified squamous epithelium, and the limbus is a 10-layer of the stratified squamous epithelium. It is the limbus that is the seat of the limbal stem cells, and the fornix that is the seat of the conjunctival stem cells. Now, what are the cells in these layers? When we talk of the marginal layer, 5-layered keratinized stratified squamous epithelium, it has got a superficial layer, which is squamous, middle cell layer, which is polyhexagonal, deepest layer is cylindrical cells. Tarsal and the orbital conjunctiva is a 2-layered structure. Superficial layer is cylindrical cells, deepest layer is the cuboidal cells. Fornix and the scleral part, there are 3-layered. Superficial layer, cylindrical cells, middle layer, polyhedral cells, and the deepest layer is the cuboidal cells. Whereas the limbus is a multi-layered stratified squamous epithelium, as I said. The superficial layer is squamous cell, the middle layer is polygonal cells, and the basal cells are the cubical cells. So this is the histology of the conjunctiva. Now, if you look at the epithelial layer, the epithelium contains the certain cells. And these are the types of the cells that are present in the epithelium: goblet cells, melanocytes, Langerhans cells, CALT and NALT. I'll talk about that in a short while. Goblet cells are present throughout. The second part is the adenoid layer. After the epithelium comes the adenoid layer or the lymphoid layer. It consists of fine connective tissue reticulum in the measure of which lies lymphocytes. It is not present at birth. First develops at the fornix after 2 to 3 months of life. So what we understand is that the adenoid layer was not present at the birth. It develops later on. And if it develops later on, it has got some applied aspect. The conjunctival inflammation in the infant does not produce a follicular reaction. So you do not see any follicle in the ophthalmia neonatorum or a conjunctival inflammation in a newborn, because there is no adenoid to react. And so we do not get any follicular response in these newborns until they grow 3 months old. And third layer is the fibrous layer, which has got collagen fibers and the elastic fibers. It is thicker than the adenoid layer, except in the tarsal conjunctiva. It lodges the conjugal vessels and the nerves. So this is the important site, the deepest layer, fibrous layer, which lodges the conjugal vessels and the nerve. Now, this is what I was talking about. The conjugal glands, there are mucin secreting glands and the accessory lacrimal glands. The mucin secreting glands are goblet cells, Henle's glands, and the glands of the mouth. Whereas the accessory lacrimal glands that secretes the aqueous, that secretes the tears, are glands of the Krauss, glands of the Wolfram, and the rudimentary accessory lacrimal glands, right? And this is the location of these different glands that I was talking about. The glands of the Henle, you can see here, there are merely folds in the epithelium, folds in the conjunctiva. It's not a true gland. You can see some glands in the mons here. You can see glands of the Krauss in the fornix, shown here. So we can see glands of the Henle, glands of the mons, glands of the Krauss, glands of the Wolfram here in this picture. All right. Mucin secreting glands, they are unicellular round or oval mucus glands. They are absent in the margin of the limbal conjunctiva. So at the zones of the transition, that is marginal zone, which is zone of the transition, and the limbal conjunctiva, which is again the zone of the transition, they are devoid of any mucin secreting glands. The mucin glands are destroyed after discharging the contents. So that they have got a purpose. The mucin glands have got a purpose. The goblet cells, they are in abundance in conjunctiva. The goblet cell density is more on the nasal side as shown in this picture. The applied aspect is that the inferior nasal part is the best site for the diagnostic biopsy. If you want to take biopsy for the study, histological study, then you must choose this nasal site, inferior nasal site. Then the leakage in the goblet cells seen in this one syndrome. So there are less goblet cells, so there is mucin deficiency. Hairless glands are the tubular structure. They are not true glands, as I said earlier. It contains a few goblet cells. They are present in the folds of the mucous membrane. That is conjunctiva. They are present in the palpebral conjunctiva between tarsal plate and the fornix. It resembles the crypts of the liver bone in the large intestine. This is the glands of the male. It is not a true gland, right? The glands of the males, they are located in the scleral conjunctiva. They are arranged in a ring around the cornea near the scleral junction. So they also produce tears. There are accessory lacrimal glands. They are known as the glands of the cows. The glands of the cows, they lie in the deep subacral tissue of the upper and the lower fornix. 4 to 2 in number in the upper fornix and 6 to 8 in the lower fornix. So they are in abundance in the upper fornix. In upper fornix, they lie between the palpebral part of the lacrimal gland and the tarsal gland. So glands of the cow, which is going to secrete the tears, are in abundance in the upper fornix, and then the tear flows and fills up the entire canal. This and serves the purpose what the tears are meant for. The glands of the wall-fins are also called the glands of the caeccio, larger than the glands of the cows. They are situated in the upper border of the tarsal plate, midway between the end of the tarsal glands. Glands of the wall-fins are 2 to 5 in the upper plate and 1 to 3 in the lower plate. They also secrete tears. Now let's look at what is the blood supply, lymphatics, and the innervation of the conjunctiva. The blood supply of the conjunctiva comes from marginal tarsal arcade, peripheral tarsal arcade, and the anterior ciliary artery. I'm going to talk about this in a greater detail. So the blood supply, I'll take you through this picture first.